Let's get into this video. It's 2025 and you either graduated from nursing school or getting ready to graduate, or you're looking to change positions, change careers, and I'm gonna help you. I'm gonna get into the responsibilities, the pay, the role, and most importantly, the pros and the cons being an operating room nurse. If you're new, my name is Rashida, and this is a community, a safe space where I share a little bit of my life, bits and pieces, but most importantly, content that will inspire you and motivate you to live your best life and to level up after 40. I want to inspire you to be your best self, dream bigger, and thrive. So if you're ready to elevate your life, stick around because your journey is just getting started. So the operating room may not be the most aesthetic or glamorous part of nursing, but it is a specialty that requires extensive training and knowledge. But most importantly, you have to want to work in the OR. Like, if you want to work in the OR, you have to want to be there. It's not the ICU, it's not med-surg, and it's definitely not an outpatient clinic. The operating room is a special place in that you cannot be squeamish, okay? You cannot be afraid of blood. You can't be afraid to see like body fluids and body parts. And you definitely can't be afraid to see the inside of somebody's body. And I mean the inside of somebody's body. But overall, if you want to be a part of a team and you want to help somebody in a different aspect, as in, helping somebody have quality of life or saving a life, then the operating room is for you. So my career in the operating room started about 7 months ago. So it hasn't been a really long time for me, but I still have enough experience where I could tell you about it. I got into this specialty right out of nursing school. I graduated from nursing school in April of 2024, and I applied to the job before I graduated. Now, disclaimer, I was already working at this hospital for going on 15 years now, but this is my first time being a nurse, and this is my first time applying to a job as a nurse. So my in may not be the same as your way in. So my job has an internship/fellowship where they train you to work in the OR. They train you in scrubbing and they train you in being a circulator. And this is for people who want to work in the OR who have not had experience in the field at all. So my fellowship was about 3 months long. It lasted from, I think we started in July and it was over in October. And we had to take an exam. Now it's from AORN, which is the Association of Operating Room Nurses. If your prospective employer does not offer like an internship like that, then they may want you to have at least a year or two of med-surg experience or maybe even ICU. And by the way, if you're wondering, yes, I have always wanted to work in the OR. Even though I got into nursing late in life, whenever I became a nurse, I knew that I was going to work in the operating room, and that's where I wound up. Okay, so let's get into the roles of working in the operating room as a nurse. So you'll either be scrubbing or circulating or both, depending on your facility. My facility trains us to do both, so we are, cross-trained. So I suggest you be prepared for that. So scrubbing. You rub your hands together like Birdman. So scrubbing is really primarily done by the scrub techs. Now I said you're gonna be cross-trained, which you probably will be, but a lot of the scrubbing, which is, you're working directly with the surgeon, passing instruments and possibly holding open body parts, you know what I mean? And you need to stay sterile to do this. Now, again, the scrub techs are, that's a different video, that's a different role, but they just scrub. They do not circulate and they do not work as nurses. They have a specific job, and that is to be the surgeon's kind of like right-hand man, other than the PA or the resident. So you'll be scrubbing, you have to be sterile, you gotta go over to the sink and do your whole wash up thing. You definitely have to remain with your hands up and not touching anything. You gotta go get You gotta go get gowned up by your circulator nurse or whoever's in the room helping out, and you have to remain sterile. That means you can't touch nothing but your sterile field, and that is your sterile table, your back table, your sterile instruments. You have to literally stay like this until it's time to get in there. And with that, you also have to understand the instruments. You have to learn all the instruments. You have to learn all the procedures, and there are new procedures and new instruments every day. This role is definitely challenging, but it's doable. If I could do it, you could do it. All right, so circulating. A circulating nurse is the manager, the boss. That's what I do. The circulating nurse is responsible for making sure that the operating room is running smoothly. He or she is making sure that you have equipment that is working and on and in the room at the time of the surgery. We're documenting, we're charting, we're making sure that people are staying sterile that need to be sterile. We set up the room, we get supplies ready. We're just making sure that everything is running smoothly. So when that surgeon walks into that room and he's ready to get gowned up and gloved and he or she is ready to perform the timeout, that everything is in that room and ready to go, because you do not want an angry surgeon. So be ready to move, because this is not a sit-down job. You have to be focused. It's going to be fast-paced. It's definitely going to be physically demanding for you. And sometimes these cases last a long time, like 3-4 hours at a time. All right, so let's talk about the environment of the operating room. You are going to be a part of a team whether you like it or not, okay? The team can be really, really big, so be prepared for that. Team will consist of you, the surgeon, his PA or resident, or whoever he has as their assistant. You have your scrub tech. You might have a rep in the room for equipment or implants that you're going to be using. And with that comes a lot of personalities. Now that's something I should have added in at the end for like one of the pros and cons, but that's a lot of personalities. You have people who like to talk, some people who don't like to talk, some people who are friendly, and some people who are not very friendly. And you have to have to understand that not everybody in the operating room or at your job in general, not everybody's going to be your friend. And I had to understand and learn that. I don't want everybody to be my friend, number one, but I do want to have a cordial, friendly, co-working space. So you're going to have surgeons that are really, really nice, and you're going to have residents that are really, really nice, and you're going to have surgeons that are not nice, residents, scrub techs, the rep, the CRNA, I forgot, the anesthesiologist. That's another person that you're going to have to be in close contact with, because you are the advocate for that patient, and you and the CRNA or the anesthesiologist is going to be, working together to make sure that that patient that you are taking care of is stable. So yeah, be ready for the personalities. Being part of a team is very crucial to your success in that operating room. Okay, so let's talk about the schedule and the hours. This is where you're probably going to contemplate your career the most. So most nurse schedules are 12-hour days. Like you'll see that in the ICU, you'll see that in med-surg. Pretty much a lot of nurses like to work 3/12 so that they can have the rest of the week off and have all those days off. I do love that. While that's not my schedule, but I would love to have those days off, but I'd rather get off early, because I don't like the 3 hours. The 3/12s really make me anxious. The operating room does offer flexible shifts. So you do have your 3/12s, you have your 4/10s where you work 4 10-hour days and you're off a whole day. Or you can work Monday through Friday, 9 to 5 or something like that. So I'm gonna add being on call as a part of the hours and schedule. Depending again on your facility, call may be different. Most people don't love being on call. Since I've only been there 7 months, I'm still kind of on orientation. I'm not on the on-call schedule yet. So a lot of people don't love call, especially the ones that have little ones at home, or you take care of family members, or you have another job or something like that. I don't know what your situation is, but working in the operating room, you're definitely going to be on call for like 3 to 4 days a week, or 3 to 4 shifts a month or something like that. At my facility, you can give your call away. So whoever's on call for the week or whatever, they can be like, you know what, I'm going to give all my call to so-and-so because she asked me for it. And you literally never have to take call if you don't want to. And with being on call, most facilities will offer you a bonus. So you will get like an extra $5 or $6 on top of whatever your base salary is. And this is just for being on call, even if you aren't called in to work. So if you're sitting at home, minding your business, and you never get called, you still get that extra money on top of your base. And here's the disclaimer: that on-call call that you might get called at 5 p.m. You could have just got home from work and they're like, hey, we got a case, we need you to come back in, and there you are driving back to work. It could be at 2 o'clock in the morning, it could be at 2 o'clock in the afternoon. You just got into your bed at midnight and they're calling you back to work. So being on call means being on call. So let's talk about the shmoney. Now, I don't really have a lot to say about the pay because that can vary from state to state. I live in Pennsylvania, and I think we have the lowest pay rate of all the states. I don't know. But I do make a good salary, and I'm still in the beginning phases of being a nurse. So I'm kind of like at the bottom. So I don't really have too much to say about the pay. What I will say is that, you know, you can make anywhere from $80,000 to at least maybe like $110,000 a year as a new nurse, depending on the state that you live in. And again, you'll be getting that extra money on top of your base pay when you are on call. Now, let's get into these pros and cons. I'm gonna start with pros, okay? So the first pro, which is what I love, is that you are going to learn so much. You are gonna learn so many aspects of critical care and traumas. You are gonna have a vast medical knowledge bank on critical care, surgical procedures, surgical instruments, and how to keep a patient stable. It's definitely exciting and fast-paced, so if you don't want to be bored, come to the OR. Okay, for the second pro I have is flexible shifts. And I am looking down at my paper because my notes are here. So the operating room offers different flexible shifts so that you can continue to take care of your family and live your life outside of work. Even when you're on call, you still have a set shift, and I do love that. Pro number 3 is you will be working in a team. You will never be alone. You will never look for people to help you. There's always somebody to help you. You know, you're taking care of one patient at a time, but your team is always gonna be there. Whenever you have a question, whenever I have a question and I'm at work, I always get my question answered, whether it's the charge nurse or another nurse, or maybe even sometimes a scrub tech. They are very knowledgeable in the instruments and the procedures. I'm always asking them questions. So you will never be alone, and you don't have to worry about taking on things by yourself. And since I already mentioned it, the next pro that I have is one patient at a time. I mean, who would not love that? This patient is literally gonna be asleep for most of the time. A sleeping patient is still a patient that needs to be cared for and needs to be advocated for. I know I hear a lot of people saying, oh, you just don't like people and you don't like talking, so that's why you wanna work in the OR. No, I mean, I really don't like talking that much, except for when I'm on YouTube. But you will never have more than one patient to take care of at a time. There's no way I could possibly work on a med-surg floor after working in the operating room. I could not imagine, and this is no shade to y'all girls who work in situations like that, but I could not see myself taking care of 6 patients at one time. I just can't. 9 times out of 10, you are gonna have 5 minutes to talk to that patient in pre-op, and when they give that patient that anesthesia, they are not even gonna remember you when they wake up. Okay, now that I told you the good things about working in the OR, let's talk about the not so good things. And the first con that I have is emotional stress. And I picked this as my first con because it's really, really important that you understand how much of an emotional toll that this can take on you. People are going to die. Trauma's gonna happen. You're gonna see children, older people, teenagers, anybody, people that were in really bad accidents coming in and they need surgery. You have to be focused and you have to turn off your personal feelings. Even if that person coming in for surgery is somebody who caused a really bad accident or somebody who did something bad to somebody else. So if seeing patients really in a bad state bothers you, the OR is not gonna be for you. I'm just trying to be real. Con number 2. Now this may be a pro for you. It's definitely a pro for me, but it could be a con for people who are really, really nursing integrated. They have to have patient communication, build a relationship with their patient's family. This role has minimal patient contact. Like I said before, you're gonna go to the pre-op area, get that patient. You're literally gonna talk to that patient for 5 minutes. They're gonna be sleeping, and when they wake up, you're not even gonna be there, so they probably won't even remember you. Now, we did talk about this earlier, but there's going to be a lot of physical labor. You're gonna be pulling and pushing and lifting and walking and sometimes running. So this was not an all-inclusive list, so if I forgot something, please let me know in the comments, and I do apologize. I just hope that this video helped you understand a little bit more about this role if you're thinking about becoming an operating room nurse. This role is challenging, but I love it. I feel proud of myself at the end of the day that I was a part of something that helped somebody have quality of life, something that helped a patient have more time with his or her family. You'll gain friends, you'll gain some knowledge, and you'll gain an experience that will take you through years to come. If you found any value in my video, please give me a thumbs up. Don't forget to subscribe, hit the bell for notifications, and send this video to somebody that you know it could help. If you work in the operating room, share your experience in the comment section, and I'll check you in the next one. Bye.